Diane, I'm glad you came in today. It sounds like you've been having a hard time these days.
Yeah, I've been having like pretty bad pain in my pelvic region, like my lower stomach area. And like one of the problems that it hurts a lot, but also kind of on top of that, it's preventing me from doing things I want to do, like hanging out with my friends, dancing. Dancing is something I've done since I was really little, and I want to be able to do it like 4 or 5 times a week, but kind of because of this, I'm only able to do it like twice. Um, and it's really, I guess, having this pain is really frustrating because it's not like people can't tell I'm in pain. It's not like I have a cast on my leg or something. So people treat me like I shouldn't be in pain. A lot of times I think I'm making it up, which I'm definitely not, I promise you.
No, that's hard. Your pain is real. Your pain is your own experience. That's what can be really difficult to sort of help people to understand that. Maybe you can help me understand a little bit better kind of what the pain feels like.
Yeah, so it's not like a sharp pain or anything like that. It's kind of dull, sore. Sometimes it throbs, but not all the time.
Can you point to it?
Yeah, it's like right here. And then also it's sometimes in my lower back as well. And I would say it's worse right before and during my period. But the back pain is there pretty consistently, even when I don't have my period.
Has this pain been going on for a long time? Or is this new?
So I'm 19 now. It started when I was like 13. Yeah, so it's been I would say a very long time. At least it feels that way to me. Probably started around my period.
Right. Have you been getting any treatment for pain at all?
No. I'll take like one Tylenol occasionally, but it doesn't really do much.
Well, it's a long time to be sort of
Yeah.
dealing with it by yourself. I'm glad you're here today.
Yeah.
So maybe you can also help me understand. So periods make the pain worse. Is there anything else that makes the pain worse?
That's pretty much like the main factor. But sometimes like moving a lot does, which is why I haven't been dancing as much. Because when I dance, it gets worse.
Okay. What makes it feel better?
Nothing that I'm really trying, I guess. Like the Tylenol will take some of the edge off a little bit, but it doesn't do that much. And then kind of just not dancing. And when I don't have my period also.
Have you tried any other medications that you can think of?
No.
Okay. And then is that the only pain that you deal with, or do you have pain anywhere else?
So I do have some pain in my jaw, like right here. But I mean, I have no idea if they're related, but that has been something I've noticed as well.
Does it seem like when one pain is worse, the other pain is also
Yeah.
there? Okay.
And this also kind of gets worse around my period as well.
Okay. So we kind of have the pelvic pain, back pain, and then some pain on the right
Yeah.
side of your jaw. Let's focus on the pelvic pain a little bit today, and then maybe we can get one of our dental colleagues to speak more about the jaw pain.
Sure.
They can sometimes go hand in hand.
Oh, really?
Yeah, yeah. As far as the pelvic pain goes, have you been making it to classes? You've been going to school? You're going to college, I think.
Yeah,
right?
so that's like another reason why if I've had this for 6 years, am I coming now? Because I'm going off to college, and like I'm going to be on my own. I'm not going to be living with my parents, so I'm going to have to deal with it more on my own. So like in high school, my classes are 42 minutes long. So it is difficult to sit for a while, but 42 minutes, like I get up and then I walk around to my next class. But in college, I'm going to be having lectures that are much longer. So that's one of my biggest concerns about going to college is managing pain, like while I'm sitting in lecture and studying.
Have you been missing any classes in the last year because of pain?
I'd say on and off, like occasionally. Maybe I'll miss one day of school like every other period, so not that many, especially because I'm a senior in high school, so like my grades don't matter that much anymore.
But at the same time, it sounds like it's really kind of affecting your dancing. Are you hanging out with friends?
Yeah.
Are you doing stuff, keeping yourself busy?
I mean, I still have friends. I'm hanging out with friends, just not as much as I used to. I really did try to keep up and like hang out with them as much as I used to, but every time I'm out with them, I just keep thinking about like how much it hurts, how much pain I'm in, and I don't really enjoy myself. So I'd rather just kind of stay home occasionally.
Has your mood been okay? Have you been
Yeah,
pretty-
it's been fine. I mean, I think I've been managing.
So you don't feel too depressed or anxious or anything?
No.
Okay, but I imagine it's been still hard.
Yeah, definitely frustrating.
Okay. And you feel safe at home, no thoughts of hurting yourself or anything? Okay. Are you in a relationship with anyone?
I'm not.
Okay. Have you had sex before?
I have, but this has been getting worse, and kind of so I can't even imagine that right now. I feel like it would be so painful. And also I'd have to talk to someone, like my partner, I'd have to talk to him about it, and that's not really something I feel comfortable doing right now.
Okay. And then any other sort of major medical problems that I need to know about?
Mm-mm.
Okay. And are you using any street drugs, any recreational drugs that I need to know about? Any heavy alcohol use, cigarettes,
No.
or anything? Okay. And then are you seeing any other caregivers for your pain, or
No.
seeing a therapist or anything, a psychologist?
Mm-mm.
And you said you haven't tried physical therapy for
I
pain?
haven't. No.
Okay. So why don't we do a good exam, and then we'll see what we can do about the jaw pain as well. I might ask a colleague to again weigh in a little bit on that.
Okay.
Sound okay?
Yeah.
Okay, great. Emma, good to see you. I just wanted to hear what how the physical therapy is going for the pelvic pain.
It's been going well. I'm really surprised how much it seems to be helping, because I don't know, nothing has helped for so long. I kind of didn't really expect anything to help at this point.
What have they been doing for you in physical therapy?
So the first time I went, it was kind of nerve-wracking, because like they did a normal physical exam, but then they also gave me a pelvic exam, which was not really something I was expecting. It was a little bit uncomfortable. But the physical therapist was really good. She kind of walked me through everything and told me how different like body parts connect, like ligaments and joints and nerves. And so we've kind of been trying different things during each of my sessions. So it's been some like massage just on like the outside of my skin. And there's also been some internal stuff as well.
Okay. And is it becoming less painful now, you think?
Yeah, it is. Yeah.
Good, good. And is she doing any exercises for your back as well?
Yeah, we did some massage stuff. I'm seeing her now every other week. I used to see her every week just because it's gotten so much better. I feel like I definitely want to continue with it, but it's not as like necessary anymore. So we kind of try stuff so I can, like the back is one of the things I still want to keep working on.
Okay. And is she giving you some exercises that you can do at home?
Yeah.
Great.
And they help a lot.
Great. I'm glad you're making some progress with it.
Yeah, me too.
Can be really helpful. Diana, it's great to see you back.
Yeah,
How are you
good to
doing?
see you too. I've been good. Yeah, I really like my school, so I'm very happy with that.
Excellent. And how's your pain doing?
It's been a lot better than it used to be. I mean, it's still something I think about a lot, but it's much, much better.
Okay, excellent. And are you still having back and the pelvic pain, or has it changed at all?
I'd say it's more of the back pain now, but it's much less than it used to be. Like, since I don't get my period anymore, that exacerbating it doesn't happen anymore.
Great. Well, last time we saw each other, there were a couple things that you couldn't do. You weren't dancing as much. You weren't really interested in a relationship. How's that going?
I'd say both are better. I
Okay.
joined a dance group at school, and it's actually been really okay, way better than I'd expect. I'm able to dance like 4 times a week. So
that's excellent.
Yeah,
That's a
so like
lot.
not up to what I was originally doing, but much, much better than before.
Great. And so you feel like the pelvic pain and the back pain is a lot more manageable
Yeah,
now?
exactly. And then I also have a boyfriend, so I am able to have, or I've been trying to have sex, and he's really supportive, and it's still, there's still pain sometimes, but it's much better than it used to be.
Oh, that's really good. And you're able to do some of the exercises still
Yeah,
at home?
exactly.
Okay, perfect. Pain takes time for it to get better. We're not looking for 100% improvement right away, so it can definitely take a few months for us to notice some differences. But we'll take a look at some of the medications that you're doing, and other ideas of some other techniques you might be able to try.
Okay.
Hi, Diana. I'm glad you're here today. Can you tell me how you got to this appointment?
Yeah, my primary care physician referred me after I talked to her about jaw pain.
Okay, can you explain to me, talk about your jaw pain a bit?
Yeah, so it's mainly on the right side, and it's not like a sharp pain, it's really like a dull, aching pain. In the morning, my jaw is really tight, and that's pretty much every morning, but I'd say 2 to 3 days a week, it's also really painful, and it kind of gets worse throughout the day.
Okay, when did it start?
So I got braces like about 6 years ago, and it was pretty much around that time that it started progressing, and I thought the braces were going to help with it, and it would kind of go away after I got them off, but it's still getting worse.
Okay, and how intense is it?
So I'd say it's mild to moderate. Like I can still, I'm limited sometimes in what foods I eat, but for the most part, I can do what I'd like to do.
On a scale from 0 to 10, where would you put it, with 0 being no pain and 10 being intense pain?
Ooh, maybe like a 3 or a 4.
Okay. And you said it gets a little more severe a couple times a week, is that right?
Yeah, and I can usually tell right when I wake up, like, oh, this is going to be a really bad pain day.
Okay. And do you take anything special for that, or do anything for it?
I'll take a Tylenol occasionally, and I mean sometimes it helps, but it doesn't really cure it or anything like that.
And you take the Tylenol every day, or just the days it's
No,
more
just
severe?
the days when I wake up and I'm like, oh my gosh, I don't know how I'm going to make it through today.
And have you had any treatment for it?
No, I haven't.
And is it severe enough where you want treatment for it?
Yeah, I would say so.
Okay, so let's go ahead and examine you today, and let's see if we can make a
Okay.
diagnosis and come up with a treatment plan for you.
Okay. Yeah.
Okay, Diana, we're going to go ahead and examine you now, and what I want to do is reproduce your pain complaint to see if we can make a diagnosis for you. Okay, and there's really 3 parts of the exam. One is checking range of motion of your jaw, both in opening and also lateral movements. Then we're going to do some palpation to see if any of the muscles or your jaw joint and those type of structures are uncomfortable. And then we're going to listen to some of the joint sounds. You said you did have some joint sounds?
Yeah, so it used to be when I'd open my mouth really wide, I'd get this popping noise, and it's somewhat as the same sensation, but it's not that pop noise anymore. It's more like a grinding, kind of like a softer clicking noise.
And do you have it all the time or just some of the time?
Just when I open my mouth really wide.
Okay, all right. Okay, we'll listen for those joint sounds and see what they are. Okay, so the first thing I want you to do is just open your mouth, but I don't want it to hurt at all, so just open as far as you can without any pain.
Okay.
Does that hurt at all? Good. I'm just going to measure that. Okay. So that's about 15 millimeters. Now I want you to open all the way with pain.
So as far as I can?
As far as you can without pain. With pain, I'm sorry. Good, okay. And does that hurt? Just going to measure that. Can you point to where that hurts? Okay, good. All right, so now I want to see what you can do moving your jaw side to side. So can you move your jaw over to the left side? All right. And that seems somewhat restricted. You can't move very well there, huh?
Yeah, and I also feel like my teeth are like kind of weird. They don't really line up. Right.
Okay. And move your jaw to the other side, to the right side. Good. Does that hurt at all? Does any discomfort here on this side?
No, it's when I move the other way it does. But
So move your jaw to the other side. And can you point to where the pain is then? Right up in there? Good, okay. And you said your bite feels uncomfortable?
Yeah, particularly on the left side. I feel like my teeth don't really match up like they should be matching up.
Okay, so let's check that. We're going to check your bite now to see what teeth are actually contacting.
Okay.
I'm going to use a material called shim stock, and this is 5/10,000ths of an inch thick, and you can't really tell that it's between your teeth, so it's a very accurate way of determining whether you have tooth contact or not. And you can see where it's just the width of one of your teeth.
Okay.
So I'll put it between your teeth, and then I'm going to try to tug on it. You close. I'm going to try to tug on it and see if those teeth have contact, and if they do, then I will not be able to pull it out. Okay? So let's try the right side first. I'm going to just pull your cheek away, and I want you to close and hold your teeth together. And that holds shim stock. Open, please. Close and hold your teeth together. That holds shim stock. Open. Close and hold your teeth together. That does. Open. Close and hold your teeth together. That doesn't. Close, and I'll just slide this. Close all the way. Good. Open. Close and hold your teeth together. And your front teeth don't hold it. Let's try the right side, the left side now. Close and hold. And that slides out. Open. Close hard. That slides out as well. So it doesn't feel like you have contact on your left back teeth.
Okay.
Okay. Is that right? Is that the way your bite feels? Like you have contact on the right side but not the left side?
That's how it feels to me.
Okay. I'm going to do a palpation exam now, and you tell me whether it's pain or pressure. Okay? And then if it is pain, I'm going to ask you if it's familiar or not, and also if the pain goes anywhere, if it travels anywhere.
Okay.
So first of all, I'm going to palpate on your cheek here, and tell me whether that's pain or pressure.
That's just pressure.
Good. And that's just pressure too?
Mm-hmm.
How about right there?
That's feeling more pain.
And is this familiar pain?
Yeah, it feels like when I open my mouth too wide or when I eat really hard foods.
And does it travel anywhere when I do that?
It's pretty much right there. I can feel it kind of up by my ear.
Okay, and does the left side feel uncomfortable?
No, that's fine.
Okay, so now I'm going to palpate right over your joint. I want you to open a little bit, please. Open slightly. And this pulls the condyle away from the eminence so I can palpate it. Does that feel uncomfortable to you?
A little bit.
Okay. How about the left side?
Not as much, no.
Okay. Does this feel like familiar pain to you as well? Yes.
Kind of. Yeah, I'd say it's similar to like when I open my mouth too far.
Okay. So I'm going to palpate up in your temples here.
Okay.
And tell me whether this is pain or pressure.
That's just pressure.
And we're going to palpate the back of your neck now. Is it pain or pressure?
Pressure.
The same?
Mm-hmm.
I'm palpating the insertion of the trapezius muscle, splenius capitis. And I'm going to palpate the sternocleidomastoid mastoid muscle. And tell me whether this is pain or pressure.
Pressure.
Okay, good. And I'm going to palpate the medial pterygoid muscle. Is that pain or pressure?
Just pressure.
Okay. Now we're going to do some functional tests for you. And I want you to just clench your teeth
Okay.
real hard. And you're going to do that for 30 seconds. And if that hurts, you can stop. Doesn't hurt. Is there any discomfort with that?
Mm-mm.
Okay, good. And now I'm going to have you bite down on a unilateral tongue blade. So I'm just going to put
Okay.
this over the back teeth and see if this bothers you at all.
Okay.
Open and clench hard. Does that hurt at all? Do you feel it right up in there a little bit?
Yeah, I'd say so.
Okay. And how about open on this side? Does that feel uncomfortable to you at all?
Mm-mm.
Okay. I'd like to see what happens if we have you bite down on two tongue blades placed across your
Okay.
back teeth, kind of opening your bite so you can't close completely, and see if that causes any discomfort or makes you feel better when you clench.
Okay.
Open, please, and close on that. How does that feel? That feels better to you?
Uh-huh.
Good. Open, please. And try this and see. We're going to place these tongue blades across your front teeth so your back teeth can't get together, and see if that makes any difference in your clenching discomfort. Close, please. Do you have any clenching pain with that?
Mm-mm.
Good. We'd like to now listen to your joint sounds to see if we can figure out what's going on with that. So I want you, I'm going to just feel over your jaw joints. And I want you to open again. Close. And I feel a little bit of noise going on there. Can you hear that?
Yeah, that sounds right.
And can you move your jaw side to side as well? And I hear that joint noise as well. So to me that sounds like crepitus, or kind of a crackling of an eggshell. Is that what it sounds like to you?
Yeah. Yeah.
Okay, good. I think that's related to some degenerative changes in your jaw joint related to a slipped disc. And you've had some osteoarthritic changes to your jaw joint. It doesn't seem painful to you now, and your range of motion is pretty good, so I think you're tolerating that okay.
Okay.
But the noise seems to be related to some degenerative joint problems or osteoarthritis in your right TMJ. And as long as it's not painful now, I think it's okay.
Okay.
So let's see if we can improve your jaw range of motion by having you go side to side on a tongue blade. So open, please, and close your teeth together. And now slide sideways. Let's go to the right, and now go to the left. That looks better. Does it feel like you can move a little bit easier? Does that hurt? Good. So that's an exercise I'd like to have you do as well.
Okay.
And you could do it 6 times a day, just for about 10 seconds or so. And it shouldn't cause any pain in your jaw joint. If you start to have pain in your right jaw joint, that means that's arthralgia, and we want to limit that.
Okay.
Okay, it's okay to have a little dull aching pain with your exercises here, which is muscle. But we want to limit the amount of pain you might cause from exercising with your jaw joint.
Okay.
Okay? So to repeat what we found today is that you have a history of a slipped disc in your right joint with some osteoarthritic changes to your jaw. And I think it's gotten pretty comfortable for you now, so most of your pain is not related to your jaw joint, but it's related to your muscle. And I think exercise therapy would really be helpful for you. It's also appropriate, I think, to see how an appliance might help you, an occlusal appliance to give you an ideal bite might help you to manage your problem long term. So it seems like your bite's off now. I think that's related to the osteoarthritic changes you've had to your right TMJ.
Okay.
So your condyle on the right side is seated a little bit more, and so that's causing you to have more of occlusion on your right side and an open bite on the left side.
Okay. So what would you do to fix that?
Well, I think the first thing to do is just test your symptoms might respond to an occlusal appliance. So it's a piece of plastic you wear between your teeth at night,
Oh, okay.
and it evens your bite. So when you're clinching at night, it doesn't cause as much forces directed to your right TMJ and your right muscles, and should alleviate some of those symptoms you have in the morning when you awaken.
Okay.
So we'll do a trial with an occlusal
Yeah.
appliance,
Did not know what that was.
and then we'll have to track over time and see if your occlusal findings or your contacts are stable. So is there any change over time? And so we can measure the occlusal contacts on your night guard or your occlusal appliance and
Okay.
see if they change over time. If they're stable, then we can think about maybe fixing or adjusting your bite so you have more contact on the left posterior teeth as well as the right. You might or might not need that to be more comfortable.
Okay.
My guess is with exercises and appliance therapy at night is we won't have to work on your occlusion to stabilize it, but it's possible we might want to do that
Okay.
at a later time.
All right.
Okay, any questions?
I think I just need to process it, but I think I'm pretty good.
So now we're going to do a couple stretch tests and see how that works for you. The first one I would like you to do is just a finger stretch. And you're going to take 2 fingers between your teeth and put them just in front of your teeth like that. Perfect. Open, please. And just hold that for about 30 seconds. If it starts to hurt, you can stop. Does that feel tight to you?
It feels okay, but it feels like if I went farther than that, that would be uncomfortable.
Okay, does that feel like some of the tightness you have in the morning when you awaken?
Yeah.
Let's try another exercise. And this one is a rotational stretch. And it's designed to stretch the deep masseter muscle and unload your TMJ,
Okay.
especially effective for people that have clinching problems at night. And I want you to take your tongue and put it on your soft palate, way in the back.
Mm-hmm.
So open a little bit and have your tongue on the soft palate. And I want you to open as far as you can without moving your jaw forward. So open as far as you can. Perfect. And just hold that for about 30 seconds. And the key to this is not letting your jaw move forward. So if you open a little bit more than this, open a little bit more, you'll see how your jaw moves forward. So you can actually take your finger and put it between on your nose and your chin, and don't let your chin come forward. So now put your tongue up on your soft palate, open as far as you can without letting your jaw come forward. That's perfect. And you should feel some tightness right here. Is that what you feel? Does that feel a little bit like the jaw pain you have? Perfect. That's great. Okay. Good. Okay. Very good. And so let's see if we can improve your jaw range of motion by having you go side to side on a tongue blade. So open, please, and close your teeth together. And now slide sideways. Let's go to the right, and now go to the left. That looks better. Does it feel like you can move a little bit easier?
Mm-hmm.
Does that hurt?
Mm-mm.
Good. So that's an exercise I'd like to have you do as well.
Okay.
And you could do it 6 times a day, just for about 10 seconds or so. And it shouldn't cause any pain in your jaw joint. If you start to have pain in your right jaw joint, that means that's arthralgia, and we want to limit that.
Okay.
Okay, it's okay to have a little dull aching pain with your exercises here, which is muscle. But we want to limit the amount of pain you might cause from exercising with your jaw joint.
Okay.
Okay, great. And what I'd like to do now is put an ice pack on your right side of your face
Okay.
to see if we can make those muscles a little bit less symptomatic and see if we can stretch your muscles out a little bit more, okay? This is something you could do at home. Maybe in the morning you could take a frozen bag of peas or an ice pack, put it on your face for a couple minutes, and you should keep it on there until your face feels a little cold and clammy and icky, and then you can do some stretching exercises.
Okay.
Then
Right after.
Uh-huh.
Okay.
And then throughout the day, you can go ahead and maintain that gain in your range of motion, or your jaw range of motion, by doing those exercises for 30 seconds to a minute. Okay, so let's try the ice pack here. And I want you just to put this on your face, right there, right over where that muscle is sore. And you're going to keep that on there for about 2 or 3 minutes until your face feels kind of icky cold. And then we want you to do some stretching. Okay, so does your face feel kind of icky cold now?
Yeah, it feels kind of numbish too.
Good, so let's take that down. I want you to just do a stretch now. So go ahead and stretch your jaw. Does it feel like you can open more?
Yeah.
You can, okay. So let's just do that the 2-finger stretch now. Take your 2 fingers and put it between your teeth and stretch open. Does that feel more comfortable to you now?
Uh-huh.
Good, great. So you can take your fingers out now.
Okay.
So that's exactly how we'd like to have you do the exercises at home.
All
And
right.
so you want to gradually increase your pain-free range of motion.
Okay.
You'd start with 1 finger, and for instance, you'd take 1 finger between your teeth, and don't bite on your finger because that's going to tense those muscles. We want to stretch those muscles. and you hold it for 30 seconds. And you do that 6 times a day. If 30-second stretches do not hurt anymore, then you can go to 60 seconds.
Okay.
And once you can go to 60 seconds without any discomfort, you can go to the next bit of opening, which would be 1 knuckle.
Okay.
And then 2 fingertips, 2 knuckles. And the
Got it,
goal would be
okay.
able to get to 3 fingertips. So once you can open your mouth for 60 seconds to 3 fingertips, then you have a normal range of motion. I think you'll feel much better.
Okay.
For you, I think the first exercise to do is the rotational stretch I talked to you about.
Okay, with the finger thing.
Yeah, with your tongue up on your palate and stretching. And then once that gets comfortable, then you can start doing the finger stretches.
Okay.
But I think you're going to do quite well.
Okay, I hope so.
Well, hi, Diana.
Hey.
This is your 4-month follow-up. So it's good to see you again. How have you been doing?
I've been doing well. It feels a lot better than it used to, so thank you, yeah.
Good. Are you doing your exercises?
I am, yeah. Getting in the routine of doing them was like I had to adjust it first, but they helped so much. So I've been doing them every day.
Okay. And so last time I saw you, you had a 3 to 4 out of 10 pain.
Yeah.
What would you say it is now?
I'd say, so last time I talked about how there was like some tightness and also pain. I'd say it's more tightness now. So the pain is maybe like a 2. But even with the tightness, it used to be really tight in the morning, and now even when it's tight in the morning, it kind of gets a lot better throughout the day.
And are you still doing your exercises?
Yeah, I am.
Okay. Every day? And how many times a day? That's the question.
So you said 6, so I do like 5 to 6.
Good. Good. Okay. And we made an appliance for you that was
Yeah.
supposed to be more for you to wear at night and make you more comfortable in the morning. Does that seem to help?
Yeah, it actually does help.
Yeah. So that should be comfortable. It should be easy for you to wear. Any problems using it?
No, not so far.
And we also try to stabilize your bite to give you even contact on both sides of your back teeth. Does that seem like that's what it's doing for you?
Yeah, I mean, it's not 100% there yet, but I'd say it's definitely getting better.
Okay. Good. Okay. So what I think we'll have to do is track over time, any bite changes you might have. And so we'll see you again in 6 months and see what your bite looks like. If it hasn't changed, then we could talk about possibly making some changes to even your bite out.
Okay.
I don't think it's necessary right now the way you've responded to treatment. We don't have to fix your bite, but you might find it more functional for you if you have contact on both sides of your back teeth so you can chew better.
Yeah,
But we'll decide that at your 6-month follow-up.
Okay, sounds good.